Patrick Hutzel from intensivecare.com with another quick tip for families in intensive care today. I have a question from one of our clients, David, who says, "Hi, Patrick. My mother is in ICU and she's starting to get stronger and more aware, but doctors used her sedation and said for her swelling to go down, but the last CT scan was on August the 8th and it's been a week and 2 days and she's breathing on her own, but she doesn't have COPD, but she does have COPD. And they're saying they don't want to take the tube out yet and want to do a tracheostomy, but not giving her a chance to see if she can breathe without it. What do I do to give her body time to heal without getting a tracheostomy?" Now, this particular client also had a history of UTI, urinary tract infection, COPD, cirrhosis of the liver with high ammonium levels. Therefore, she was on lactulose regularly. She was also partly confused because of the high ammonium levels. She also had a brain hemorrhage and also had some seizures. So, because I know the situation very well because we worked with this client very closely, here is what we recommended at the time. What we recommended was to get her ammonium levels down, right? So that she can be more awake. How can you get ammonium levels down when someone is in liver failure? You can get it down by giving lots of lactulose to increase bowel motions and increase the frequency of bowel motions. And therefore, ammonium is coming down, clearing up the brain for patients in ICU. So then what also should happen or needs to happen in a situation like that, stop all sedation, stop all opiates, and see whether a patient can wake up. You see, the issue is, and this is a client in the US, the issue in the US is there is nowadays a lot of complacency in ICU. Instead of weaning someone off the ventilator and the breathing tube, which is often an art rather than a science, they're moving towards a tracheostomy and a PEG tube pretty quickly to then move patients out of ICU into LTAC. And that is a big challenge, and no one should be, having a tracheostomy prematurely or a PEG tube prematurely until a trial extubation has at least been done. So what does a trial extubation mean? It means you're taking out the breathing tube, assuming someone is on the lowest ventilator settings, which means pressure support / CPAP, PEEP-5, FiO2 less than 35%, good tidal volumes, good minute volumes, normal arterial blood gases, patient is awake, can obey commands, can have a good cough and gag reflex, can clear their throat and secretions. That's when you should do a trial extubation. And if patients then struggle, you could do a high flow nasal prongs, you could do BiPAP or CPAP non-invasively. And again, if all of that fails, you can then re-intubate and do a tracheostomy, but not giving it a go without optimizing care and treatment is not appropriate, really, right? So in this situation, the client eventually did end up with a tracheostomy, but, at least she had some time off the ventilator at the time. She then went downhill again. At the end of the day, you never know how a trajectory goes. By the same token, you have to give it a go. And many patients with our consultancy here have managed to stay off the ventilator and avoid the tracheostomy, but you've got to give it a go. But you also need to have your loved one in a good ICU. Not many ICUs or some ICUs nowadays have a really low skill mix and skill level because many senior ICU nurses, quite frankly, have left the industry because they've been treated so badly. But one way or another, this is what needs to happen in a situation like that, so I hope that helps you understand. The biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. That's exactly what you are dealing with here, what David has been dealing with. We've helped hundreds of clients over the years and members, and we've gotten spectacular results for them, and you can verify that on our testimonial section. I can confidently and without the slightest hint of exaggeration say that we have saved many lives for our clients in ICU and our members. And again, you can verify that on our testimonial section or on our intensivecare.com podcast section where we've done client interviews. I have worked in critical care nursing for nearly 25 years in 3 different countries where I worked as a nurse manager for over 5 years, and I've been consulting and advocating for families in intensive care all around the world here at intensivecarehotline.com since 2013. And that's why we created a membership for families of critically ill patients in intensive care. And you can become a member and get advice from us and advocacy and consulting if you go to intensivecarehotline.com, if you click on the membership link, or if you are going to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in the membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, making sure you make informed decisions, you have peace of mind, control, power, influence, so that your loved one gets best care and treatment. In the membership, and I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. I talk to you and your families directly. I talk to doctors and nurses directly. And when I talk to doctors and nurses directly, I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. We also do medical record reviews in real time so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to our intensivecarehotline.com email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.